we know education is a basic human right which allows for fulfillment of other human rights. Education provides foundation for individuals' professional, economic, social, and personal development. Education has proven to affect all aspects of life, including general well-being, productivity, social capital, and it makes one responsible citizen with sustainable behavior. The 2030 Agenda for Sustainable Development includes Sustainable Development Goal 4, which aims to ensure inclusive and equitable quality education and to promote lifelong learning opportunity for all. The education is said to be equitable when educational practices, policies, curricula, resources are representative of all students, such that each student has access to, can participate in, and can make progress in high quality learning experiences, regardless of their race, socioeconomic status, gender, ability, religion, linguistic diversity as well. Equity ensures that need of individuals from disadvantaged socioeconomic backgrounds, individuals with disability, and other deprived minorities are provided with educational tools, resources, and support. Enhancing equity in education leads to improved economic, social, and individual outcome that will increase chances of employment, productivity. Equity in pharmaceutical education improves opportunity of education, and it will improve life of a person in a whole. Asian countries have witnessed impressive gain in education, university education. However, there are serious concerns about leaving further behind the groups that are already marginalized. There is no doubt that higher education supports economic growth and human development. And the rapid expansion of higher education system has had positive effects in every country. However, with the premium associated with tertiary education becoming higher and higher, those who won't be able to afford will be left behind. In a large number of Asian countries, equity issues are now generated in higher level of education, including pharmacy education. Access to tertiary education is affected by, among other things, students' overall well-being, their social origin, cultural background, socioeconomic condition, and even gender. Although the world has made progress in both absolute and relative number of enrolled students, the difference between richest and poorest, as well as those living in rural and urban areas, have not diminished, and this still affecting enrollment of students in pharmacy education in our context. South Asian countries are very diverse, not only in number of population, but also there lies vast range of diversities in geographical, socioeconomic, cultural, political, or development characteristics. Despite of making substantial progress in education, gaps still remain throughout this region. For instance, in many countries, quality of higher education are only accessible for selected groups. Even within a single country, population is in a several way highly diverse. Let's take example of my own country. Nepal is a democratic country, it values and embraces the diversity. But we can still find inequity in education due to people's socioeconomic status, gender, caste, ethnicity, language, and geographic location. There exists inequality over here due to lack of equity in access, like students with disability, as well as those from poor, remote, low caste families or from disadvantages ethnicities are disproportionately affected by education gap. Girls from certain marginalized communities, like girls from Madhes, Muslim community, are underrepresented in university enrollments. Access to education even decreases when girls come from low caste or disadvantaged ethnic group. Children from Dalit communities have lowest, in fact, access to even the basic education. Not only in Nepal, not only in student enrollment, we know that female representation in Asian academias senior rank is also low than the international standard. UNESCO has reported that a number of girls, women who have gained access to education in the region increased substantially from 2000 to 2016. Although more girls and women in the region are able to access educational opportunities, females are still at a disadvantage, particularly those in rural areas. So despite significant progress over the past decades, girls and women continue to lag behind in education in Asia. Classes, linguistic background, gender, ethnicity, place of birth all have impact on educational experience in neighboring countries and other Southeast Asian region as well. Now, next cause of inequality over here is due to lack of equity in participation. To ensure equity in participation, education system should ensure equitable participation by all at higher education without discrimination and providing opportunities to fully utilize their ability for benefit of higher education and society as a whole. Students' equitable participation in higher education can be viewed in terms of fair and consistent admission policies, ensuring students require skill for fuller educational participation, their placement, specifying learning objective for each courses, appropriate assessment techniques which reflect students' attainment. As far as I know, equity in participation is also something which has plenty of room for improvement in this region. Poor health condition also limits students' ability to attend classes regularly. In this case as well, equity of participation is highly compromised. Another cause of inequality over here is due to lack of equity in learning outcome. We all know, as I'm saying, opportunity to learn are more favorable to boys than girls. There was a study conducted in Pakistan which reported inequitable education in higher education to unavoidable extent. So I can say that inequities in pharmaceutical education is there in high extent in Southeast Asia region. Access to education is fundamental human right. No one should be discriminated because of their social background, gender, religion, age. Unfortunately, many barriers to education persist, preventing individuals from realizing their full potential and contributing meaningfully to society. Wealth, language of instruction, disability, disparities by gender, ethnicity, gender, and other factors are there, as well as the intersection between them remains significant barrier to accessing and fully participating in education globally, including this region. Classrooms are also made up of diverse students. However, schools and teachers are not necessarily equipped to provide equitable and quality education to all of these students. There are different drivers or facilitators of inequalities in education in this region. Like first thing I would like to put is government policies. Access to education is a fundamental right of citizens of the nation. However, access to education in this region, you cannot say it is satisfactory. Still, there are people deprived of education in countries where many plans, policies, programs have been formulated and implemented in the name of education. If we analyze among the caste, ethnicity, religion, reasons, group, and between genders, class of people, there still remain disparities among them in terms of access to education. The children who are from high caste with sound economic status have higher chances to get good facilities of education, and they have high chance of employment opportunities in their life, whereas those from low caste with low economic background do not have access to good facilities of education, and they do not have chances of employment opportunities as well. Access and opportunities are largely depend on educational policies and plan of the nation. A viable education plan and policies, education system can play a great role to reduce this disparity between gender, caste, ethnicity, etc. And another thing is there is decreasing trend in budget allocation. It was identified, reported by some countries, and there should be increase in investment of government in educational sector. There should be policy to make higher education easily available, of high quality, accessible to all, with considerable facility of financial assistance to the needy one. Another barrier for the problem we are talking is the family or the socioeconomic condition of the family. In our society, family influence plays a very important role in academic life of a student. Socioeconomic status of family in one way or other affect academic achievement. Students from lower social class origins are less able to get academic degree they wish than those from higher social class background. Differences in family income, class, culture, parents' education status as well, and other factors are likely to differ their access to education, their academic success is also affect the access to the academic institution they want to join for the degree they wish to get. Students have different needs which are important for their academic achievement. This may include conducive studying atmosphere, good food, provision of books, study materials, attendance at best school or colleges available. All these help students promote effective learning at good and also get good achievements in their study. Limited income restricts the provision of fund for food, clothing, tuition charges, examination, etc. If you analyze the kids who get good learning environment and proper guidance, they generally have better performance in their class. Their results will be good. On the other hand, students who do not have such facility, they may be far from learning. Their performance in the classes and results may get affected due to this lacking. Hence, socioeconomic status has multiple impacts on students. And one particular important impact including academic achievement. When I'm saying this, I would also like to mention a bit different finding on impact of two meta-analyses done some time back looked at a socioeconomic status and impact it has on student achievement. Those studies found that there was weak to moderate impact. Students of lower socioeconomic status with competitive academic achievement exhibit other characteristics that can help them achieve academic success in health profession schools, such as the grit and hardiness which these students develop because of the distance they have to travel to make same academic achievements as students with higher socioeconomic status. Those who had seen hardship are more hardworking. This is true in a way. But it is also a fact that those wishing to pursue higher studies should get proper support of assistance. Many countries set up scholarships or other relief systems precisely to allow students from low income families to attend university. People should have access to proper education as a jumping off point in their life. There should be proper tuition assistance systems. We can find this system in our region as well, but not very comprehensive as it should be, to give every needy students equal access to higher education. Also, tuition fee at some of the public universities, colleges for pharmacy courses are higher. It should be kept low so that students from low income families can also get admitted easily. In some cases, this acts as a barrier for enrollment of students from poor or marginalized family. Then another barrier I found is caste or ethnicity. social inequality in Asia is expanding more rapidly. Race, ethnicity, gender continue to act as a profound barrier for equity in education globally. They continue to represent a major dimension of social stratification, and they cause differentiation in access to education in both developed as well as developing nations. Access to education should be equal, ideally, among all the caste and ethnicity group. However, in some Southeast Asia countries, implicit biasness toward students' race, caste, ethnicity can be seen. There are disparities among caste groups in terms of access to education. We can see cases of high caste groups, children having easy access to good academic institutions with sufficient learning material, and they have been guided very well by their parents. I do not have data on university education, but there are reports on effect of caste ethnicity on school education in Nepal. I guess situation for university student will also be more or less similar to this. It's written that children from low caste group do not have access to school, and if they have, they do not have access to learning materials, and they do not have special care from parents due to their low income in their family. Besides this, education result is also not seen equal in all caste, ethnicity as well. UNICEF reported that in Nepal, children from marginalized caste have poor result compared to other caste group. There could be numerous causes behind it. Ethnicity is another factor that lead to inequalities in education. In one paper, it's reported that ethnicity is the second most important circumstance for inequality in higher education in the Lao People's Democratic Republic and Kazakhstan and Vietnam. In the same context, it's also reported that a significantly lower level of education were found among the Dalit caste in Nepal. In India, there are reports of abuse, humiliation, and harassment low caste girls on the way to school, including sometime at the school by upper caste teachers, contributing to their high primary school exclusion rates. This relation between ethnicity and education often intersects with other circumstances, such as coming from poor or rural household. And beside this, residential location is also another one of the barrier. There is great education disparity you can see between rural and urban areas of the country. Students from rural areas, again, if they have poor economic status, will have much difficulty in continuing pharmacy education due to inadequacy of financial assistance. In my country, pharmacy colleges are located mainly in the capital city and few in other places, but almost none in remote areas. So students from rural places, from remote areas, get difficulties during their study period. So from Southeast Asia region, there are reports on discrimination of students on the basis of race, color, religion, national origin, gender, age, disability, etc. in access to academic programs or activities that has led to inequities in education. There are several barriers, major barriers to address inequalities in education that are prevalent in Southeast Asia region, in my view, can be, but not may not be limited to. First one is gender discrimination, gender inequalities, gender inequities, which I have already discussed. Because gender discrimination is very highly prevalent in Southeast Asia region. We can see influence of patriarchal norm and values in societies. Women suffer lots of discrimination in the field of education, along with other discrimination. Due to poverty, opportunities for education, women may remain out of their education may remain out of their reach in some places. Another is the financial constraint of the family, which again I have already discussed. Another thing I would like to explain over here is resource constraint. Resource-related inequities such as financial, infrastructure, human and technological inequities in pharmaceutical education is also one of the common issues for which we see in pharmacy education. This region has a relatively low level of resource allocation in support of education of pharmacy students, which might affect enrollment of students in pharmacy programs. This may not apply for all Asian countries, but there are many countries which get problem due to resource constraint. Cost of material resources, including textbook, student amenities fee, technology requirement, and other course cost, are frequently affecting decision making on enrollment in pharmacy programs. Infrastructure is another limitation in pharmacy colleges or universities in this region. However, as I mentioned, it may not apply for all. In some institutions, due to insufficient infrastructure, due to insufficient classroom, labs, it's difficult for interested students to get admitted. Studies have confirmed that conditions and qualities of school facilities can positively or negatively impact students, teachers, and overall academic achievement. If students get well-maintained classroom, universities or colleges are structurally sound, it will help students feel supported, they will feel valued. Students are generally better able to learn and remain engaged in instructions. Teachers also, they are better able to do their jobs in well-maintained classroom, which has good lighting system, which is very clean, spacious, air-conditioned as needed. On the other hand side, if classroom's temperature is very hot or too cold, overcrowded, dusty, poorly ventilated, then students and teachers will suffer. Students' performance improves in good school facilities. So inadequate infrastructure in some of the academic institutions in our region have impacted educational equity negatively. Next factor in the same context is technological difficulties. This was felt terribly at the time of COVID-19 pandemic. Pharmacy schools, colleges worldwide faced several challenges in ensuring sustainable education during that phase of pandemic. Because of COVID-19, many universities have transitioned to emergency remote delivery of course, mostly online with no face-to-face interactions. For educators and students shifting to an online approach and remote teaching learning, the major concern was additional cost of equipment, the internet connection, and other web-based. Some students do not have stable internet connection due to limited infrastructure in their location. There was also no financial support or minimal assistance provided, which was not enough to support faculty, students located in geographically isolated and disadvantaged area. There were several cases where students and teachers were stranded in villages far away from any town. They have difficulty in getting access to internet. As a result, they couldn't teach, they couldn't attend their online classes. So education got affected at that time due to this resource constraint. At that time, some of the Southeast Asian countries started initiative for sustaining education. I have read that Government of India designed an initiative to achieve three cardinal principles of education policy, namely access, equity, and quality. The main objective of that initiative, which was named Swayam, was to provide massive open online courses. There were other initiatives as well to make online education accessible to all. High-speed internet was also provided to academic institutions. Likewise, in few other countries, government and some private bodies supported continuing pharmacy education. However, some countries that include my country as well, due to unpreparedness for such situation, due to lack of resources, could support minimally. Education. Education was not halted at all, but it was very difficult for us at that time due to lack of resources. Support from the government was also very less at that time. My university continued education, online education. Somehow student got graduated timely, but other universities, other colleges suffered a bit at that time. Institutions in this region commonly mention socioeconomic and IT infrastructure as important parameter that determine possibility of continuing education by remote learning in such a difficult situation. Technological skills, well, it can be addressed with some effort, but limitations like lack of equipment, insufficient internet connectivity, these are barriers that are difficult to address for academic institution readily. I would like to say this much on this. There are a few recommendations from my side for the academic institution to FIP to address these education inequities within this region. Academic institutions, they should provide assistance to students who are experiencing potential barriers like disabilities and those from a disadvantaged background. There should be provision of stipend for needy ones. Students from low socioeconomic background are likely to be vulnerable to financial and educational constraints. However, the provision of equity-based scholarship for students from those backgrounds will have potential to overcome those constraints. Academic institutions should support women's education as well. In higher education, we see in most of the Asian countries that men catch up or surpass women, with a few exceptions. There should be policy interventions to facilitate women education by providing incentives or scholarships for women to complete their education, higher level education, and get better jobs. At the same time, institutions should also focus on strengthening quality of education by investing in teachers' education, training, lab equipment, infrastructure, and making sure that the current curricula correspond to future health sector needs to facilitate employment of the students in future. Technology have given a world of opportunity to people. It's a great way to close the gap between rich and poor. Online platforms are providing blended and e-learning opportunities for students. For students living in rural areas who cannot afford coming to the universities, remote learning is the key to provide them access to education. For this, of course, some investment need to be made. There should be training facilities for faculties as well. Training in communication skill, training in soft skill is equally important, along with making them efficient in their subject matter. They should be treating all students equally, irrespective of their demographics, irrespective of their socioeconomic condition. So soft skill, that is very important. All students must be given equal chance for participation in academic activities. So building teacher capacity to create inclusive classroom is of utmost importance. Every school should have curriculum updated to meet not only the need of this region, but global need as a whole. If required, schools should undertake reforms in pharmacy education to address the changing landscape of health and healthcare delivery. And then next, I have a couple of suggestions for FIP. I would like to suggest FIP to continue supporting developing countries for strengthening pharmacy program in this region. FIP can strengthen pharmacy programs by providing training opportunities, by providing exposures to faculties, especially in clinical settings, since most of the Southeast Asian countries are still lagging behind in pharmacy practice. Exchange program for students is equally important to get some exposure in pharmacy practice so that they can jumpstart their career right after graduation. Of course, online courses, webinars, these need to be more frequent. This is, of course, going on more frequently after the pandemic. It is helping us a lot